Hello everyone. Now we will see understanding the stage 2 cancer. What are its symptoms, treatment, and is there any hope for the patients and their families? So I am Dr. Amit Chakraborty, head and neck cancer surgeon based out of Specialty Surgical Oncology, Mumbai. So in stage 2 cancer जो है ये stage 1 cancer से थोड़ा बड़ा होता है साइज. It starts affecting nearby tissues. बाजू के टिश्यू में भी चले जाता है. It hasn't spread to any other organs or major lymph nodes. So this stage often means the cancer is still localized but beginning to grow and become more noticeable. So what kind of problems or dangers might patient face in this stage? At this point, the patient may begin experiencing functional problems such as difficulty in speaking, chewing or swallowing. There might be a visible swelling, discomfort or bleeding depending on the tumor location. If it is left untreated, there is high risk of progression to advanced stages. So which are the symptoms which can help individual to identify stage 2 cancer? Common symptoms and signs include that a persistent ulcer or a sore throat in the mouth, pain or difficulty while eating or talking, swelling in the jaw, cheek or neck, hoarseness or change in voice, a feeling that something is stuck in the throat. These symptoms tends to be persistent and more obvious than stage 1. So if the cancer is diagnosed at this stage, what steps should the family and patient take? The first step is that you should remain calm and act quickly. Get all necessary scans done, tests done to confirm staging. Consult with an oncologist and start discussing the treatment plan. This is the time to rally emotional and logistic support for appointments, care coordination, and moral. What is first step towards starting the treatment? The oncologist will usually recommend further staging investigations like MRI, CT scan, or PET-CT and do a biopsy. Once a staging is confirmed, a multidisciplinary tumor board review will occur on the case and advise on a treatment strategy. The treatment options that are available at this stage 2 are most of the times it is surgery followed by radiation or radiation with chemotherapy in rare cases. Based on the tumor location and tumor type, chemo or targeted therapy may be added. The goal is still curative, but it may require more intensive approach than stage 1. What are the chances of recovery in stage 2? The recovery chances in stage 2 remains very good if it is treated on time. The 5-year survival rate is very high, around 65 to 80% depending on the type and location of the cancer. Outcome depends heavily on how early the treatment becomes and how the body responds. How should a patient prepare mentally and physically at this stage? Mentally, they should acknowledge the seriousness but stay hopeful. Talk to your doctor openly, involve your family and avoid misinformation. Physically, stop tobacco and alcohol immediately. Eat high protein, nutritious meals and stay active as permitted.